everyone, and welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Kimani Hendricks, and I'm joined today by Dr. Adam Chaifetz, who will address MS and disability. Dr. Chaifetz is a board-certified chiropractic neurologist. Since 2008, he has been the program coordinator for the Comprehensive MS Center in the Department of Neurology at the Jacksonville campus of the University of Florida. He manages the program through the interaction with patients, providers, and ancillary staff personnel. He is also a strong advocate for patients and interacts with governmental relations, representatives, and federal or local legislature. Dr. Chaifetz has been in clinical practice since 1987. His expertise has always been in the collaborative medical environment. He has run and managed the largest chiropractic practices in Jacksonville. As the first chiropractic rehabilitation center director in Jacksonville, Dr. Chaifetz has always been at the epicenter of collaborative care with his patients. Utilizing medical physicians in practice, his patients have always enjoyed and benefited from a thorough, comprehensive approach to healthcare. After his presentation, we will leave it open for your questions and comments, but Dr. Chaifetz, thank you for being with us today, and I'll turn it over to you.
Okay, well, thank you all, and thank you for having me today, and welcome to all of those that are listening in on this real important subject. Having been in practice as long as I have, and having worked here in the MS Center I'm going on my 15th year, we've had to address the issues of disability, and it ranges, of course, from patients who have had multiple sclerosis for a long period of time to patients who are just newly diagnosed. So I'm going to go through a series of steps here that I think patients will find valuable if they have ever questioned the disability process, if they've recently been diagnosed with MS and they don't know anything at all about what their future is. I'm going to outline some things here that are going to give a clearer picture of how patients qualify for disability and kind of the steps or the process that is the best way to go about this. So the first thing that we're going to talk about when it comes to disability and multiple sclerosis is that MS is not automatically a disease that condemns a person to disability. Generally speaking, patients who have had a condition like MS for a long period of time are going to be much more prone to the disability process, but patients who are diagnosed now, currently, have such really good treatment options that we are trying our best to delay the process of disability a lot longer in patients who are being diagnosed now. So another factor that is going to determine disability determination is going to be the type of multiple sclerosis that a person has. A majority of people have relapsing remitting, but there are other variants such as primary progressive, which can be very debilitating. So it's important that the diagnosis is clearly understood. Some things that need to be documented for sure are going to be the date of the diagnosis, when it started, what treatments the person's had, and when the person was able to work a gainful employment situation. Now, your employment situation may have went from full-time to part-time. Your employment situation may have stopped completely because of losing your job because of calling out for medical issues when you didn't have a diagnosis. So there's a lot of issues that can document a patient's course and how they've done from the beginning. And medical records are really your best determinant of how to document your condition. So understand that when we talk about the term disability, we use the term disability simply to say, can a person work or not work? But realistically, disability is a legal determination, and that's why there are courts, the Social Security courts, and the judges who work for Social Security, they are the determinants of disability. Physicians and medical providers and healthcare providers, we literally determine impairment, which means the degree of which the person is affected by the disease. And so an example I give to a person is, let's say as a right-handed person, my job, my profession is I'm a violinist. And if I lose my arm, I have my right arm amputated. Yes, I could work another job, but could I continue to be a concert violinist? And the answer is pretty obvious. So let's look at how the Social Security Administration considers MS. MS is considered to be a chronic condition or an impairment that will cause a disability severe enough to prevent a person from working. So there are two different types of coverage that a person can have. And the first of which is called SSDI, or Social Security Disability Insurance. And the second one is the Supplemental Security Income, or SSI. So when we look at how the Social Security Administration determines whether a person is disabled or not, it has everything to do with whether these components which they outline for disability are met. So the first thing that they look at is what's called disorganization of motor function. So hemiparesis and motor weakness includes like weakness in your arm, weakness in your leg. A lot of times when a patient has a relapse, it'll be one-sided. They may lose function of their right arm and right leg. Those are qualifying things that Social Security would look at. A person could have an optic neuritis or an optical relapse, which affects their vision. So if a person does have a visual impairment, that is a significant determinant in disability. As patients get down the line and have MS a longer period of time, things like cognitive dysfunction, memory problems, and even depression can start early on in the condition. And the last thing that Social Security looks at as a determinant is fatigue of repeated motor function. Now, that's not fatigue or the feeling of feeling tired. What that is that refers to if you continue to test a motor component like a muscle in your arm, and let's say you test it repeatedly 3 or 4 times, the longer you test it, the weaker it becomes. So what that usually indicates is central nervous system involvement causing motor impairment. Now, the disability determination services are usually regulated through each state. And so there are state agencies that are in charge of making the medical decisions as to whether the person is entitled to Social Security disability benefits. And medical evidence and documentation is going to be required. So folks, let me give you a scenario to where you would probably not qualify for disability. If you just had suffered your first relapse and you end up in the hospital for 3 days and you're diagnosed and they tell you you have multiple sclerosis, that is not going to automatically give you a situation to where you're going to be automatically approved for it. So multiple sclerosis is not a life-threatening condition like ALS is. When a person's diagnosed with ALS, they're almost immediately approved for disability. Now, with multiple sclerosis, it's a little bit different, okay? In order to qualify for SSDI, you have to be between 21 and full retirement age, and you have to have worked at least 5 of the last 10 years and paid into the system. And then, of course, you have to be unable to work and are expected to be unable to work for 12 months or even indefinitely. You're going to need your financials. Okay, so if you lost your job and your income was X last year and you don't have an income this year, you're going to have to compile your financial information, your employment history, all of the pertinent things to demonstrate to a judge that you have lost income because of your condition. Now, what I recommend for patients is to get a notebook, kind of like a school notebook like this, that has plastic binders in the middle of it. And as you compile your medical records, your employment records, your taxes, keep a record of everything in one place so that when you go through the process, you'll have access to everything that they require. Okay? Now, the medical information, this is the most challenging for patients, to be honest with you, because many times we have an electronic health system here at the University of Florida, so patients can have access to their medical records through a program that's called MyChart. And if you all participate in a medical system to where they share your medical records and you can print them off, that is a valuable asset to patients. And it's important to keep chronological records and summary of your doctor's visits. So the best way to start would be with your family physician or whoever referred you to the neurologist or the hospital for your diagnosis. You want to make sure you know all your providers and specialists' names and the dates of your visits pertaining to your disability. All of your medical pertinent information needs to be compiled in such a manner that whoever's reading it has a clear understanding that you are in a certain circumstance which would not enable you to work. Now, if any of you have ever read medical records, some of you may be surprised to know that many or a majority of doctors do not always find it necessary or even pertinent in some areas to mention things like Mrs. Jones is here today and she cannot work because of her blindness in her right eye, her weakness on the left side of her body, and the fact that she has fatigue all day. Okay, you're not going to find that in the medical record. Instead, what you're going to find is you're going to find abbreviations in the history of things. You're going to find a medical exam, and sometimes the records may not be as complete as they need to be to form that picture that's needed so that when that Social Security determinant judge looks at it, that it's clear to them that you have a bona fide disability. So you as a patient have to play a role, and I'll tell you how to do it as we go through this, because some or many of you, I can imagine, have been through this, and hopefully at the end you can share some of your experiences. So the things you want to keep track of are going to be how long your condition has kept you from working. So if you notice that what Social Security needs as a determination is, are you going to miss work for 12 months or longer? So if you went from being diagnosed with MS 5 years ago, walking, and now you're in a wheelchair and you have a number of different things that have come about since your diagnosis, your records need to clearly demonstrate your journey from point A to point B where you are now, okay? And so some folks who can help with this are rehab individuals. If you go to physical therapists, occupational therapists, if you go for counseling, whether it's psychological counseling, these are all things that help document your condition. And so if you do have depression, mention it and go to somebody who's a professional. If you have other issues, the best way to get it documented is by seeing specialists within that field, okay? And I hate to say it, but your family doctor, they have enough to handle with just family medicine. So relying on them to paint the picture for your total disability situation is not always going to be the best avenue to go, okay? Although I'm sure they will be helpful. So when should a person consider disability? What gets me is when I have a person who's super young, just diagnosed, hasn't even been put on therapy yet, and they're already considering disability. So I don't look at that as a positive way to get started when you're treating your condition, because as I mentioned before, those that have been diagnosed recently, and when I say recently, within the past couple of years, they fare a little bit better than patients who were diagnosed decades ago, okay? And so there are some major factors that determine disability. Remember, we talked about disability being a legal determination, and how if you're a right-handed violinist with an amputated arm, you're going to be disabled from what? Playing violin. Will you be disabled from being a greeter at Walmart? No. Okay, so when we talk about disability, the Social Security Administration wants the person to not be able to do any occupation at any time. Okay, so that's why the process is so difficult, because they don't want to make it easy for a person to basically get paid if they can work some sort of job. So here are some examples. So let's say a person drives a cab, is an Uber driver, a Lyft driver, does delivery for food services, it drives a bus, is a transportation driver, is a long haul trucker, makes a good living, okay, as a trucker, drives across the country, has a relapse, and it's an ophthalmic relapse, okay? They have an optic neuritis, and let's say they end up partially blind and they lose their CDL license. Well, that person is going to be in a very precarious situation, mainly because if that's their only training, they're going to have to either be retrained for another profession with a disability, or they go ahead and they try to go through the disability process. With a patient, okay, let me go back here. All right, so everybody I think understands that if you're a cab driver, a bus driver, somebody who's in the a pilot, an airline pilot, who would want a blind airline pilot? Raise your hand here, okay? So there are certain conditions that who would want a blind pharmacist? We had a person who lost his vision as a pharmacist, wouldn't be able to do his job appropriately. So those are some examples of somebody who would become profoundly disabled from just one aspect of a relapse. All right, now let's go with this guy here, who is a person who over time has steadily and progressively lost the ability to ambulate. Medical records demonstrate that, maybe 5 years ago, he was walking with a cane, and then he went to a rolling walker, and then now he just finds it, too taxing physically to walk. So he utilizes a wheelchair when he's out and about. That could be a portable one, or it could be a scooter that he has too for outside. And the thing about it is the gentleman also gets fatigue. Now, I'm not talking about muscle fatigue. I'm talking about tired fatigue. So he's exhausted after about 5 hours. Now, if anybody knows the pace of a CEO, they're probably working long 10-hour days. So is this guy disabled? Well, he could still work. Would his job offer a part-time status? That's where we all get into a pickle, okay? Because it's not really easy as a CEO or a concert violinist or a pilot to find a part-time job, okay? So it's one of those things where your impairment is going to have a large determinant of your disability, all right? So how do you document the impairments that you have throughout the course of your MS experience? Well, these are some recommendations that I can give you. Now, I will tell you what patients do in our practice here. And many patients who look at the disability process, they utilize an attorney, a law office that specializes in disability. And what these attorneys do is they will mail you a stack of forms. And what those forms will essentially be what's number 1 here on the screen, and it's called a functional capacity exam. And this is where the law office is asking us, how long can Mr. Jones sit? How long can he lift, bend? Can he move above the waist? And so what they're asking is basically the doctor to complete a bunch of forms for nothing. And I think what you find is that when you bring in these reports that the law offices give to you, many times the medical offices are not, I would say, thrilled to do these. And many offices, if they do them, are going to charge you a fee. And the reason is because the questions that are asked by the attorney are detailed. And what the attorneys are trying to do is get information essentially without paying for it. So a decent attorney would write a letter, request a report that has certain aspects of your treatment in it. And these reports, called narrative reports or summary reports, are honestly the best way for a patient to get a total understanding across to the judge, because everything is in a summary form. Keep in mind, if the judge has to sort through all these medical records that don't make sense, that have abbreviations, that are incomplete, that don't mention disability, it's really hard to put a picture together that you, Mrs. Jones or Mr. Smith, meet the criteria for disability. So one of the ways that you can use a tool in your tool belt is through physical medicine and rehabilitation. So one thing you can do is if you go to certain physical therapy offices, they can do a physical capacity evaluation. Now, this is a very, very, very effective tool. If you are disabled and you have a functional capacity evaluation done and it documents your disabilities, this is gold standard material because this is what we call objective evidence of a person's disability, okay? If you, and some of our MS patients have baclofen pumps, see physical medicine doctors, which are called physiatrists. They're also experts at doing these kind of evaluations. Another helpful tool to utilize is going to be the psychology field, and that would be a neuropsychological exam which demonstrates or documents a person's cognitive, mental decline, predilection for depression. You want to make sure that any of the symptoms that we talked about that qualifies a person for disability are addressed and mentioned. Now, of course, there has to be objective testing. So in order to get the diagnosis of multiple sclerosis, MRI testing is done. Many patients have had lumbar punctures, blood work. So there's a whole myriad of objective tests that are used to demonstrate how you were diagnosed and how your progress is going. Now, those of you who were disrupted with COVID for your regular office visits, it is time to get back and see your providers because lack of documentation will affect your ability to get disability if you haven't been seen continuously and regularly. Now, let's say you apply to the Social Security Administration on your own, and they go ahead and they request all your medical records. And they, like all people looking at medical records who aren't medical providers, there's a huge question mark that goes up because they're not qualified to assess the records. So in cases where patients try to possibly apply themselves without the assistance of a company or an attorney, what may happen is Social Security may send you to one of their examining doctors, and that is called a consultative exam. Now, keep in mind, these doctors are not specialists in MS, and they're rarely trained in neurology. So what you have is an untrained doctor who works for the government, who's looking for every single reason to negate your disability. Okay, so they're not going to make it easy for you, which is the reason you have to have a pile of medical documentation to combat really biased exams like a Social Security disability exam. Now, Social Security disability insurance is just as it is. It's an insurance program. So if someone rear ends you and drives off, we don't feel bad calling our insurance and saying, listen, the rear end of my car is 3 blocks backwards. So if a person needs to get to the point of disability, they shouldn't feel bad about it if they've worked a number of years and have paid into the program. Okay, so it may be characterized as welfare, and people are free to characterize government programs any way they like. However, the reality is it's a federal insurance program, and we pay for it through our taxes. And so not only does it provide medical benefits, it can also provide potential cash and funds to patients who who qualify for it. Okay. And so in order to be eligible for the process, and of course, I would encourage those who are seeking this to go onto the website and look at everything thoroughly. Okay. And most people know that they have to have worked and paid into the system for about 10 years with your FICA taxes. And have a severe disability that is caused by either injury or disease, and it has to be severe enough from working any job. Okay, and I know this because as a chiropractor, I had a back injury in 1996, and that's why I have not practiced full-time as a chiropractic physician since 1996. I had to retrain. I retrained in neurology, which is my specialty. And that's why I'm here at the UF in the Department of Neurology, is because I was young when I was injured. I had good disability insurance. I retrained within my profession, and I was able to find an avenue to use my skills to get a decent job that I could apply my skills to. Now, not everybody is that lucky, okay? And so if a person, like I said, is a violinist or a bus driver or a pilot, they may not have a lot of options for retraining, all right? And so if that happens, then this is where Social Security disability would come into play. SSI is supplemental security income. So with this, the person must have a severe enough disability that prevents them from working. And it's supposed to last for 12 months. And the person has limited income and assets, low enough to meet certain thresholds. So unlike SSDI, the person does not have to have a work history to qualify. This is based upon income and assets. So both offer different benefits, and it is possible to qualify for both of these at the same time. Now let's talk about these different things that the Social Security Administration utilizes to determine disability. So the term disorganization of motor function refers to basically persistent impairment of motor function in two extremities. So as we mentioned, many people, when they have a relapse and they have a spinal cord relapse, they may lose function in their right arm, right leg, left arm, left leg. If we have motor function disruption by way of either paralysis or tremor or involuntary movements or something called ataxia, where the person literally is off balance, they can't balance, right? Or they have a spinal cord injury or a cerebellar problem. There's a whole number of different things that can cause this, all right? Unfortunately, with MS, because of there being so many different areas of the brain and spinal cord that MS can affect, all right? So when we look at this disorganization of motor function, this is where your neurologic examination comes in. So folks, remember, your doctor can't assess your neurologic exam over the phone or through telemedicine. So this is why neurology is one of the specialties where you have to see your provider. You have to make sure that they test these things and document. Visual impairment. So visual acuity may occur with, with near vision or far vision or both. And so there are different corrective aids that can be done through optometry. But some patients have optic nerve involvement that doesn't improve after a relapse or multiple relapse. And unfortunately, that can cause, permanent loss of optic function. And then mental impairment. So we don't see a lot of cognitive impairment in MS in the early stages, even though it does peak its head depending on how severe the disease is and how long the person's had it for. So, and to be honest with you, we've diagnosed patients as young as 9 years old. So my 9-year-old patient who we saw 15 years ago is now 24. Is it possible for him to have cognitive problems? Yes, it is at 24 years old. If you understand, he was diagnosed at 9. All right. Again, the medical record would show that. Now, with mental impairment, we're talking about behavioral abnormalities that are associated with some sort of brain dysfunction. So the best way to document these things is going to be through a neuropsychological exam. So the best thing to do as an MS patient, even if you don't have cognitive issues right now, the best thing to do is to have a baseline cognitive exam done, and then in the future, have a follow-up one done. Now, if you are struggling now and your family members are making up for your cognitive issues, or your friends, or you're missing medications or doing things that are out of the ordinary, then it's time to, get this documented and get a handle on it, because there may be, some help for you out there if your provider knows it. So some examples of demonstration of loss of cognitive abilities, or even changes in affect, okay, can occur with MS. So if a person becomes disoriented, like they drive somewhere and they don't know how they got there, or they're just lost. Memory impairment, well, I'm 62, so it comes with age. And this is where you have to differentiate memory impairment, normal aging versus memory impairment due to MS. Perceptual or thinking disturbances, which would be more psychiatric. Changes in personality, changes in mood. And then one condition that can happen frequently in MS is emotional lability. And there's a condition called pseudobulbar affect. And for those MS patients that are not aware of it, some patients with central nervous system conditions, patients with ALS get this too, where they'll have just uncontrolled episodes of crying, of anger outbursts, and they can't control it. And their loved ones are kind of a little bit startled when it happens, because they don't know anything about it. And there is a medication or treatment for it. So if you're experiencing any of these symptoms, it needs to be documented again and also treated. And then if there's a loss of intellectual ability of at least 15 IQ points. And of course, how would you know that unless you were following with a psychologist that was measuring that? So if you see a person drastically change in their mood, personality, and just their psyche, loved ones, caretakers should be concerned. Now, from the disability aspect, what they're going to look at is these psychological dysfunctions causing either marked restrictions of activities of daily living, restrictions in maintaining social functioning, difficulties in concentrating, and then repeated episodes of decompensation. So some of these can be really, really dangerous because patients nowadays are not on just injectable meds. We have a lot of patients that are taking oral meds. And if you're not able to remember things when you took your meds, just basic things, it could be really disastrous. And then fatigue is described under the criteria here. So we talked about fatigue. And again, I'll mention it. We're not talking about that overwhelming tiredness that can happen with an MS patient. What we're talking about is fatigue of motor function, which is muscle weakness on repetitive activity. So basically, if you're a person whose legs are weak with MS and you have difficulty ambulating, the longer you ambulate, the harder it is for you to walk. That would be evidence of reproducible motor function. So one way that this can be documented is if your provider does what's called a 25-foot timed walk. So if your provider does this every time they see you, you can see over time how your walk is affected if your mobility decreases. All right. And then, of course, you have to have the documenting diagnosis and symptoms and then obtaining evidence that the system has actually become fatigued. Now, how would you do that? Your best way would be through rehabilitation, through physical therapy and rehab, documenting that you have a prolonged fatigue with motor use. Because let's face it, when your provider, whether it's your nurse practitioner, your PA, or your neurologist, when they examine you, they don't do repetitive testing. They just test you at one time grossly and then move on to other aspects of the exam. So this is where physical therapy may be a valuable tool in documenting this impairment. All right, so let's say you're young and you will not let MS interfere with your willingness or wantingness to try to keep working as long as you can. But what if you're the one-armed violin player or the one-eyed bus driver and you need to figure out some options? Well, every state has vocational rehabilitation programs that are designed to help people that have both physical and mental disabilities either retrain or get a job that they may be qualified to do. So like myself, I went back to school. I trained in neurology. I had to find avenues that I could handle that were within my academic set that I think I could pull off. And it worked out great for me. And I've seen people honestly get on a treatment regimen. I see their conditions stabilize, and I see people living pretty normal lives for a long period of time. But let's say you're not in that. You know, let's say you're in between. You've had MS for a while. it's affected you, but you don't feel like you're ready to put in the towel. Well, vocational rehab is an option, okay? And so what you would do is you would try to check with your area to see where your county vocational rehab centers are, okay? And so if you're already on SSDI, you're presumed eligible for these services. And vocational rehab could help find you employment if you're so inclined to use their services. So some of the things that they would offer would be medical and psychological assessments, vocational evaluation, career counseling, training and education, and then job site assessment and accommodations. They also do job placement, coaching, on-the-job training, supported employment. They help with assistive technology and also with some medical and psychological management. So as we wrap up here and we talk about what a person should do, I'm going to stress to you that the best place to start in the process, if you feel that you have come to the point where this is a real option for you, then you have to initiate a conversation with your medical provider, with your neurologist, your nurse practitioner, your psychiatrist, your physical medicine doctor, your pain management doctor. You need to put them all on notice that you are potentially seeking this. And you have to also make sure that you organize all of your medical information and understand yourself, what is in your records before you start the process. So that's why, again, I'm going to reiterate, if you have the opportunity to look at, download, and print your medical visits and keep a chronological record of them, okay? Maintain your compliance with doctor visits. Let me tell you what doesn't fly in disability. You're diagnosed with MS, you haven't seen anybody for 5 years, you've lost your ability to walk, and you have no documentation in between the time you were diagnosed and the time you couldn't walk. That is probably one of the worst case scenarios, because the judge and Social Security Administration doesn't have any objective evidence to fill in the chapters of the story from point A to point B, okay? And then the other thing is too, is that this is a daunting process, okay? And a lot of times patients try to take it on by themselves. And that's an honorable try. But keep in mind, many or most of these cases end up denied the first, sometimes even the second time around. So in order to even initiate the process, my recommendation is to know what kind of evidence you have in front of you. Read it. Is it clear to you, reading it as a lay person, that you're disabled? If you find that the documentation is not there, this is where a provider who writes a summary report or a narrative report to encompass all of the aspects of your treatment from A to Z, that is the type of report that generally wins over a Social Security judge, because everything is defined for them. Now, keep in mind, if you meet the criteria that Social Security lays out, and your doctor can artfully and carefully point these things out, it makes the process 100 times easier for the judge who's doing the determination and the patient who's going through it. Now, I can speak from experience because we have had patients in our practice, a number of patients who have gone through this. Now, in a comprehensive MS center like ours, we're a big MS center, we have a variance of patients. So many of our primary progressive MS patients have been able to establish disability a little bit easier than patients who have the relapsing remitting course, who don't have outstanding blaring impairments in their medical condition, and who feel like disability may be for them, but they're not sure if they qualify. It's an ongoing thing that patients deal with. In my best recommendation, I would say the following. You are gonna fare better the longer you stay in the system. So the longer you can work, the longer you can accumulate your Social Security benefits, the longer you can accumulate time that goes towards the parameters of qualifying for these situations, the better off you are. The system doesn't like to award disability, but it will reward disability to those applicants who either have an obvious impairment and or the documentation is impeccable. And these are my best tidbits of advice that I can give to any patient who's going through this. So in our city of Jacksonville, we have 3 different vocational rehabilitation locations. So what you need to do is look at your geography. If you're in between work, looking for a new vocation, or just have questions about their programs, I would encourage you to look them up. So in conclusion, we talked about the process and how detailed and lengthy it is, and it's directed at individuals who are completely disabled from any employment. So like one patient who was going through the process said to me, he said, "Doc, I'm applying for Social Security disability." I said, "Oh, really? Okay, well, no problem." He says, "But I have a little side job cutting my neighbor's yard." I said, "Sir, that is not total disability. You need to rethink your situation." So remember, when a person applies for disability, they are supposed to be completely disabled from any employment. Now, that's not my determination. That is Social Security Administration. You want to have several objective specialist viewpoints that are recommended. So that might be from an ophthalmologist, a neurologist, a psychologist, a pain management doctor, physical medicine doctor, or physical therapist. Discuss disability with your provider so that when that 15-page questionnaire that their attorney wants filled out shows up on the door, they'll know why. You want to attempt staying in the workplace as long as possible. You want to listen to your provider recommendations, okay? Now, think about this. Let's say you were diagnosed with MS but refused treatment, and you never went on any treatment, and your condition got so bad that now you're in a wheelchair. So I'm not saying that that would stop you from getting disability, but if the judge knows that you've refused active treatment. I'm not going to say either way whether that would sway the judge to decline you, but I do feel like they feel like if there are treatments available, that they want a person to attempt them before going into a disability status. And then lastly, newly diagnosed patients are generally not good candidates for disability unless they have a very aggressive or progressive and debilitating course from the get-go. And we do have patients that meet that criteria, unfortunately. And those are the people who probably end up qualifying a tad bit easier. And with that, these are the references that I've used from the National Multiple Sclerosis Society and ALSUP, which is a company who assists patients in getting disability. I'm not a paid advertiser for them. And then also the vocational rehabilitation brochure from our local VRs. Once again, I thank you, and I'm happy to answer any questions if anybody has any.
Awesome. That was a really great presentation, Dr. Chaifetz. I have a question. Would you mind sharing these files with anyone who might want to take a look at them later?
Oh, no, my pleasure.
Awesome.
Absolutely.
Perfect. So if there's anyone out there who wants to request a copy of this PowerPoint, please respond to your confirmation email of this conference, and then we'll be able to send them over to you. If there's anyone who's watching us from Zoom who would like to ask a question or leave a comment, you can do so by either typing them into the chat box or the Q&A. The Q&A option enables you to ask your questions anonymously. And if you'd like to speak directly to Dr. Chaifetz, you can always use the raise hand feature in Zoom as well. If you're on a phone and would like to raise your hand, you can press *9. But we ask that everybody who does raise their hand, please wait to be asked to get unmuted so that that goes smoothly. And if you're watching us from Facebook, you can obviously just type your questions into the comment section below. So we do have a few hands raised and some Q&A.
I see there. I can go ahead. I'll just go ahead and answer Catherine's question first, which is, Catherine says, I have a private disability insurance through my job. In your experience, is it easier to qualify through private disability versus SSDI? Well, they're both a pain in the neck for sure. And it really depends on your provider, because I work with providers who believe their patients. And if their patients feel like they can't do the job any longer, our providers will support their disability process. But it's important to know, Catherine, some of the reasons that you feel like you're disabled. And in terms of getting disability through your private policy, that's what I had to go through. And I was very successful utilizing my disability insurance when I was only like 36 years old. So if you feel like you have a disability and you have private disability insurance, you sort of have to go through that process first before going through Social Security disability. And I hope that kind of answers your question.
We have 5 hands raised. First one I see is Antoinette. Can you please unmute so that we can hear you?
Does anybody want to know why I'm wearing a sweater in Florida? No, I'm kidding.
It's not that far into me. I'm from New Jersey and I can't get let go of all my hoodies and boots. I don't know where I'm going with this, but
It was 49 degrees in Florida. That's why I'm wearing a sweater. So, anyway.
Karen, can you unmute yourself? Antoinette, we're going to get back to you, but I don't know if you're trying to unmute, but we can't hear you.
Karen, you there?
Can you hear me?
We can.
Okay. I am Karen Chaifetz. I'm a college professor. And I'm 53 years old. And I've almost put in 30 years here at the university. My question is, I've been just going round in circles about when can I retire? I know I cannot work until I'm 67 years old because I've already utilized a cane and walker for mobility, and I've built most of my courses online, so that helps a lot. The job and the technology helped me to be able to accommodate that way. However, I don't know how much longer I can do it.
How old are you?
Tired at 53.
53?
Yes, sir.
Okay. Have you talked to your providers at all about it?
Yeah, I've been kind of talking with my HR person, and I'm just trying to get my mind wrapped around it. It's all so confusing sometimes. And but like I said, I'm still working. However, I just don't know if I can do it even for 60 until I'm 67 years old. I don't think I have that in me.
Okay. Now, have you worked at least 10 years and paid
Absolutely.
into the system? You have?
Yeah, oh yeah, 30 years, in 6 years, it'd be 30 years here at the university.
Well, ma'am, I think you've done your time, and it's one of those things where you technically qualify. Now you just have to make sure that your providers are going to support you and give them the medical evidence that, you know, without getting into depth with your medical conditions. So some of the things that I reviewed in the presentation have to apply to you, or they have to state a really good case as to why you wouldn't be able to continue to work, okay?
I was thinking of at 62 pulling out. But I mean, I just don't know how all of this stuff works and how much more longer can I go at this? But I know I don't want to work until I'm 67. I just don't, I'm tired.
Well, the thing to do is try to get your ducks in a row while you are working, because
Right.
if you have the private disability insurance that's offered through your work, that would be the first avenue of how to start the process.
Okay.
Okay?
All right. Thank you very much.
You're welcome. I'll tell you what, let me answer a question here from Michael. Michael says, I have primary progressive MS. I'm still working, but it's becoming more difficult. I'm 62. Should I apply? So, Michael, here's the thing. If you're working, you're my age. And if you're working until 62, my feeling is you've put in some years in the system. And I would say if you've gotten to the point where you feel like you would like to try, it couldn't hurt. Now, keep in mind, if they were to award you Social Security disability, you'd get Medicare early. And the other thing is that you would be paid disability for 3 years until you hit 65. So if you feel like you've hit that point to where you just can't do it anymore, I certainly can sympathize, because there are days that I feel like I'm in the same boat. So I appreciate the question. Let's see, Vicky, next question here. Is getting Social Security disability less stringent if applying at 57? Any more likely than younger? So they were diagnosed in 2020, dropped to part-time in 22, and then left employment due to fatigue and cognitive. So the answer to this one, Vicki, is going to be based upon if, again, if you paid into the system for the 10 years, then you should be eligible if your providers can give you the documentation that you need to fulfill their criteria. So applying at 57, you know, we have people that try to apply in their 30s and they're kind of surprised that they're turned down. When a person gets into the 5th decade of life at 57, there's a much higher likelihood that would probably work for you in your favor. All right. So I hope that answers your question.
Dr. Chaifetz, we have a question from Facebook, Heather. She says, what if you could only work part-time and not full-time? Would you be able to apply while still working?
So again, you would have to speak to an attorney who specializes in Social Security disability. But my understanding is to get full Social Security disability benefits, you basically have to be unemployable. The person who works part-time would benefit from a private disability insurance that would compensate them for their loss of income. So let's say they lost half their income and they had private insurance, they might be able to collect through a private disability policy. Does that make sense? Because they may not qualify for Social Security, not having participated long enough.
Got it. I just want to take a minute and address Gwen, Anna, and Damaris. We see your hands raised. Are you guys, we'll start with Anna. Are you able to unmute?
Yes.
Great. We can hear you.
Okay, thanks. I am in this, Aval, this is a great presentation and very timely. I have submitted the online application and I'm way over it. I forgot how many, 2008 is when I was diagnosed. So I like to meet almost all of the criteria of what would qualify a person for SSDI. And I think I made a pretty good online application. Now I'm amassing the medical records, which are huge because it's so long. And so I love this idea of summary reports. So I'll be asking my doctors. So should I ask my doctors to make those and give me a copy and I put all of this stuff in a giant envelope or a box and send it to SSDI with my Social Security number, which I think is what they said to do on the SSDI website?
Yeah, you might, a lot of these Social Security attorneys will give you a free consultation. And I'll be right up front honest with you. The Social Security Administration, if you're applying for SSDI, they limit the amount an attorney can get. So they get, I think, about $5,000 for the process. All right. And that's why when you think about it, that's not a heck of a lot of money to handle a pretty complicated case. So a lot of times they make the patients do the legwork for them. Now, the report that I talked about, Anna, I'm going to tell you, this is something that I have done personally for my providers here, because you see, chiropractors, we treat a lot of patients that are involved in car accidents, and a lot of those involve detailed reports. So we learn over time to write these reports. Many medical physicians just don't do them. And so you're going to have to ask your provider to write a summary report for you, because when you ask them, they're probably going to look at you like they don't know what you're talking about. All right. Because think about it, they think that everybody understands their medical records. And to be honest with you, doctors do not always put everything in the record that needs to be there. And that's why a summary report, like I mentioned, is a really, really good idea. Did that answer your question, hopefully?
Yes, but just to clarify that, I would still leave it to the doctor to write the summary report.
Yeah, but here's okay. So when you look at your medical records, is it clear to you that you have a disability?
I don't know. I'm still waiting for them to come in the mail, but I did have an appointment with my neurologist's PA last week.
Yeah.
And I brought her a copy of my online application and the parts from the National MS Society guidebook.
Yeah, perfect.
And when I handed that to her, she said, "Oh yeah, we've written. Dr. Lulu has written quite a few of these. This is very familiar." The thing that's a little tricky is that I have two different neurologists, two different locations that retired. And so I've only had this neurologist a year, but she should have all of my records because it's the same office. It's just, it's the same database and she can look at everything, but I hope that she can write me a good summary.
Well, but it sounds like you're on the right path. I mean, if they acknowledge that they're willing to do it, you've won the battle right there. I mean, sometimes I have people, I deal with doctors and residents that don't want to do any of that kind of stuff.
Mm-hmm.
And that's how I end up doing it because I have an expertise in this. But that's not to say every doctor does and every doctor wants to do it, Anna. That is the problem. And that's why so many patients get denied, is the medical records are not clear enough to substantiate the problem.
So to the timeline then, would you suggest if I just submitted that online application literally like 11/21, I think it was. So I'm getting all these records together and I should in the next week or so send them all in one unit, or just as I get the records, send them in like maybe 3 packages?
So get the records, scan everything, scan and save everything. And then what you want to do is organize it and label it. I would make it like a notebook. I would not send a box of records. If you organize it in a notebook, neurology, physical therapy, imaging, and you have a book for them to read, that will make your process golden. That's how you would send it. Don't send a stack.
Love it. Great suggestion. Thank you very much.
You're welcome. And the MS Foundation can give out my contact information if anybody would like to get in touch with me. But Anna, you're on the right track. You've done everything right.
That was also what I was going to ask you, Dr. Chaifetz. If we don't get to everybody's question, can we send them to you and then get them back to everybody?
Yeah, let me just answer a question here from Antoinette. Question is, she first applied, was denied in 2015, reapplied in 21 with the help of an attorney. When approved, will my back pay be applicable to when I first applied? That's a good question, Antoinette. My prayers are for you to get paid as far back as you can. But the reality is I've seen patients get paid back as far as 2 years. So I'm hopeful you're going to get something back. All right. And congratulations for getting approved. That is a huge thing. Many patients go through battles. All right. And then from Dina here, what course would you recommend for someone who has been a stay-at-home mom for 8+ years to have a chance for applying for disability in the future? Well, for a homemaker, and the most important job of all, being a stay-home mom, you want to document how it's affected your ability to care for yourself and your family. And you want to make sure that your provider documents that. And the fact that you're a stay-home mom should not be a disqualifying factor, other than the fact that you do have to meet some of the parameters for paying FICA taxes into the disability system. So, Dina, hopefully in your younger years, you've worked at least 10 years into the system, and qualifying would be what you would need to qualify. Okay. Any other questions? I've got a couple others written here. I can.
That all depends on you. I was going to ask, how long do you have to stay and answer a few more?
I'll go for a couple more minutes if you'd like.
Okay. So let's get back to the people who have their hand raised. I believe
Okay.
Damaris, are you there?
Yes, hi. Can you hear me?
Yes.
Hi, Damaris.
Hi. I actually I live here in Florida, and I do go to the UF and see a doctor in there, and I'm very thankful for all that he does. I do have a question for you. This is really good information. I've been on the workforce for 30 years, and I was diagnosed with MS in 2017. I'm beginning to see some problems with my cognitive problems and short-time memory.
Okay.
I was recently laid off from my job, and I really liked my job because it was a remote job and it worked perfect for my disability, for my illness, for MS.
Sure.
Now, I enjoyed this because this is going to prepare me for the future when I do have to, if I do have to file for disability. I am trying my best to stay in the workforce because it mentally helps. However, do you have a seminar or something that could guide people that will want to know how to disclose the fact that I'm disabled and not be embarrassed, or talk to HR to see if instead of 90-day probation, they can do 120 days due to the fact of my disability?
I find, it's unbelievable here at the University of Florida. You wouldn't believe how many people I work with have MS.
Mm-hmm.
But the thing is most HR departments are going to work with you with the diagnosis. Now, have you gone through FMLA and documenting FMLA in the past?
Back when, before I was diagnosed in early 2000, I did have to use it at that time.
Right. So these are little bits and pieces of documentation that I think are helpful, that demonstrate kind of your journey from A to B to where you are now.
Mm-hmm.
So now, and also, you might want to speak to somebody who's a specialist, either as an attorney or some of these companies that assist patients. I'm not sure if there's a local Social Security office that actually would assist you in the process.
Okay.
Hard to believe government helps with anything, right? Anyway, I hope I answered your question there, Damaris.
Thank you.
You're welcome. Thank you.
Anna has another question in Q&A, Dr. Chaifetz. Do you see it? She asked for a link to find SSDI.
So it depends on where you live. I can tell you that they are few and far between that specialize in MS. So depending on where you live, you might want to think about contacting some of the local law offices that deal with disability, just to see, if there's somebody you can talk to about it. But here in Jacksonville, Florida, if anybody would like a name of a disability attorney here in Jacksonville, Florida, her name is Tracy Tyson Miller. And she is a attorney that I've been working with for 15 years, and she has an expertise in MS. And I don't know if she would handle cases outside of this geography, but we've been successful with her in getting some patients on SSDI. Okay, Michael wants to know, do I recommend exhausting private short-term and long-term disability prior to applying, or do you suggest applying while on the private insurance? I think I would go the private route as long as possible, for the simple reason that they're probably going to pay you more unless you have a really high income job and you have qualified for the maximum benefit. And usually Social Security disability wants you to use your private insurance before tapping government resources. So that's what the avenue I would go. And then Bonnie's asking, if someone has additional medical issues in addition to MS, will that help get SSDI? The answer is yes, Bonnie. That's where your storybook. So let's say you have MS, like I'll throw something out there. We have actually had more than one patient that had MS and Parkinson's disease at the same time. So we don't know what can happen to a patient. And yes, there are comorbidities or other medical conditions that occur with MS, not because of MS. And yes, they can complicate things. They certainly can. And then, do you suggest we retain an attorney or try it ourselves? Here's what I would suggest, just like what Anna did. Go onto the website and survey the process. If you feel like it's too daunting and you could not handle it totally on your own, getting every bit of information they ask for, organizing it, and presenting it to a person in your behalf, then I would say some help would be in order. I'm not going to say that I know people who have done it on their own is a large percentage. Most people I know have had some help along the way, but I don't underestimate our MS patients. We have some very talented, brilliant folks that have been afflicted with MS who have been able to do quite a few things on their own. So I have no doubts that a person can do it if they want to do it. All right.
Dr. Chaifetz, there's one more person whose hand is raised. Kate?
Sure.
Hi, can you hear me?
Yes, I can. Kate?
Great. Hi. Thanks very much for all this information. And my question is similar to the question from the stay-at-home mom who just asked you about being out of the workforce for 8 years. And so I have worked like 30 plus years over my lifetime, contributing, like getting credits for those work years. But I'm just getting ready to apply for disability now. And I was told that I'm not eligible for SSDI because because in the last 7 years, I wasn't contributing to FICA wage. So even though I have all those years of contributing to Social Security, they're not in the most recent 10 years. And so suddenly I'm really stuck if this is true. Do you know about, can you advise me about this?
No, I really don't. I would have to obviously advise you to check with with Social Security Administration to qualify exactly what your circumstances. Now, is there any way that you feel like you could get into the workforce again? If perchance you have to qualify for so many more years? Is that a possibility for you?
Well, the problem is by the time I'm 58, so by the time I requalified with like 10 years of recent work, I would just be anyway on whatever it is when you just retire.
So right. So when so I think in your circumstance, what would give you additional income? It sounds to me from the criteria that I understand that you would have to work 5 more years continuously.
Hmm.
And
Oh.
so again, I would either check with a Social Security attorney or with the department, because it just doesn't seem right that you've worked that many years, but you're not qualified.
Right. I see what you mean, but that is what they told me. And I was hoping that there was a way around it. They told me that because there's this gap, that I had all those years of work, but then there's a 7-year gap, of the most recent years, and that there's no way. So when I talk to the people at the SSDI, main line, they say like, no, there's no way around that. I was just hoping that with your experience, you might have known how somebody got over that.
No, I honestly,
Yeah.
I've not, we haven't encountered that.
Mm.
I think that the ones that we encounter are the really super young folks who have super aggressive disease, who just haven't had the ability to even be in the workforce long enough to contribute. But you may want to consult a Social Security attorney on that.
Okay.
They're going to be a lot better qualified to give you the specifics on that. But hopefully some of the information I've given you here has been helpful.
Yes, that's the thing. Like, this is very helpful about how to communicate with my doctor. But then, as with everyone, then there's all these other, kinds of criteria that are tricky. So thank you for your.
You're welcome and good luck. Okay, Kay? All
That's
right.
Time we have for today, everybody. Thank you for staying a little later, Dr.
Oh, my
Chaifetz.
pleasure. And thank you for having me. And I want to wish everyone a very wonderful, healthy, blessed holiday season, whatever you celebrate. Please enjoy yourselves and your family and stay healthy.
If you missed any part of this conference, you can head over to the Multiple Sclerosis Foundation's Facebook page, and you can watch the recording of the live stream after we close out the Zoom presentation here. Our next conference will be on Tuesday, December 6th with Dr. Ben Thrower, who will be doing MS Trivia holiday style. So come for that. It's always a lot of fun. So please also follow MS Focus on Facebook, Twitter, and Instagram for times and access information. And within a few weeks, more than likely 1 or 2, this recording will also be on the Multiple Sclerosis Foundation YouTube channel. and on SoundCloud and msfocusradio.org. And thank you guys so much for your questions and for participating. I think we had over 100 people in here.
That was pretty good. Thank you so much for everybody's attention, and God bless you all. Have a great holiday.
Have a great one. Bye, Dr. Chaifetz. Bye, everybody.
Bye, y'all. Thank you.